right, welcome back. It is time for Here's to Your Health, brought to you by All Care Health, shaping the future of healthcare by combining healthcare services and insurance plans. Everything you need, all under one roof. Well, we're always happy to welcome professionals into the KAJO studio. And today we have Dr. Alexis Andridis. Did I get it right?
Kind of.
I worked on it.
You did.
You go ahead and you pronounce it for me.
My name is Alexandridis. Most people just call me Dr. Alexis because it's a lot easier.
And that's the way we're going to go from here on out.
Yeah.
All right. Well, this is March, or March is coming up here in just a week or so, and March happens to be Colorectal Cancer Awareness Month. And why should people be aware of colorectal cancer? That's
a great question. So colorectal cancer is very common. It's basically the third most common cancer in the United States. In 2016, it's estimated that 95,000 people are going to have a new diagnosis of colon cancer, and 39,000 people are going to have a new diagnosis of rectal cancer. That's a lot. That's about 5% of our population that's going to be dealing with colorectal cancer. It's also the third leading cause of cancer deaths, and it's estimated that 49,000 people in the United States are going to die of colorectal cancer this year. So it's kind of a big deal. So we have a great screening opportunity to help prevent and screen for colorectal cancer, and that's why we want people to be aware of it.
Well, who would be an ideal candidate or the most susceptible? Who would that be?
So colorectal cancer tends to hit men and women relatively equally. It is generally recommended that once you turn 50, as a 50th birthday present to yourself, you should get your colorectal screening completed. And we usually do that with a screening colonoscopy. If you have a family history of colorectal cancer, like your dad or your mom had colorectal cancer or have it in a sibling, then we usually recommend that you get started screening a little bit earlier. The screening test, the colonoscopy, pretty easy. There's lots of mythology out there. Lots of people are going to tell you don't do it. It's awful. But they're lying to you. It's not awful at all.
I have had the colonoscopy, and
what'd you think?
The procedure is nothing. You know, you go to sleep, you wake up, you get the diagnosis. The preparation is probably the most inconvenient.
It's inconvenient. It's changed a lot over the last few years. Rewritten our prep instructions. That's what we call it, the bowel prep. We've rewritten those instructions and tried to make it as easy and as tasteful, if you will, as possible. We try to just have it, be with your own favorite liquids, and, you're going to just drink half of it in the evening and then half of it in the morning. And it usually works pretty well. If you follow the instructions as we've written them down, it's really not too onerous. The important thing is that you get your colon cleaned out, because otherwise when I'm in there looking at the lining of the colon, I'm not going to see the polyps that I'm looking for. And the polyps are really what we want to find. That's why we're doing this test.
How would you describe in best layman's terms a polyp? What is it? What does it look like?
Exactly. So the normal lining of the colon is nice and smooth and pink. It's going to have lots of folds, and it's going to expand when we're doing the scope so we can see all of the little nooks and crannies in the colon. But it's all smooth and glistening. And if you've had a good prep, then there's no poop on it. So that's important. Polyps are little bumps. They look kind of like little warts on the lining of the colon. Or they can be bigger. They can be the size of a peanut M&M, or they can be the size of a walnut, or they can be the size of a cancer, which is actually a polyp that has completely changed into something that's really dangerous. And that can actually take up the entire volume of the colon in that area. We don't want to see that. That's why we like taking them out when they're small, when they're just like little olive or grape size.
Right. I think you just ruined peanut M&Ms for me right there. But
yeah.
It's one of my favorites. Once they're removed, then they're inspected. They go through laboratory tests and what to determine if they're cancerous or not.
Yeah, our pathologist will then look at them under the microscope with some special stains and tell us if they're precancerous growths or not. If they're the precancerous growths, we call that an adenoma or an adenomatous polyp. Those adenomas, once that particular adenoma is out and it's in the buckets in the pathologist's office, that adenoma can't hurt you anymore, right? It can't keep growing and turn into a cancer. You might, however, make other adenomas. Once you're an adenoma maker, your colon might pop other ones up. And that's why we usually recommend screening an adenoma maker or someone who's made polyps before. We screen them a little bit more frequently, maybe every 5 to 7 years, depending on what it looks like, because we know you're at a little bit higher risk for developing a colon cancer.
Okay, the procedure itself, a colonoscopy, about how long?
Usually about 30 minutes of procedure time. It's usually sandwiched with a half hour to 45-minute check-in time where we place an IV so we can give you sedation for the procedure. And then there's the half hour to 45-minute wake-up time at the end. I tell you, 99.9% of the time people wake up from the sedation and they ask me if we've started yet.
Right,
it's really quite pleasant.
Well, it was. I noticed nothing, and I had really no discomfort, no anything. And so recovery is almost instantaneous.
Yeah.
I would imagine it would vary for people, but
for the most part, it's very easy.
Yeah, so it's pain-free, and it's something that people need to do. When you start looking at numbers, 95,000 new diagnoses expected this year.
Yeah.
And
it's the real deal.
Yeah, it's number 3. And so when you look down the list of what can get to me, that one's right up there near the top.
Now, what we've actually seen, and this is why we think it's such a powerful test, is that as screening colonoscopy rates have increased, and we've done more of them, the diagnosis of colon cancer has decreased. And we think that's because we're screening for it, and we're able to take these polyps out before they become a cancer.
Yeah.
So hopefully we can get colon cancer to be much less deadly and maybe just much less prevalent overall.
Well, I think with cancers in general, early detection is paramount.
For the most part, that's true. And for colon cancer, it's very true.
Okay. Let's see. I had another question right there on the tip of my tongue there on prevention. Is there anything people can do to lessen their chance of contracting this?
Yes, there is. There's certain risk factors that are not modifiable, right? So you can't change your age. You're going to get older. That's a given. You can't change your family history. You can't change your genetics if you have a genetic predisposition to colorectal cancer. But you can change other things like obesity if you're carrying extra weight. That's a risk factor for developing colorectal cancer and a lot of other cancers for that matter. You can change your diet. We believe that lots of red meats and processed meats can exacerbate your risk of forming polyps or making colorectal cancer in your colon. Low fiber diet has been associated with colorectal cancer, so more fiber in your diet and sort of leaner white meats. Certainly more fruits and veggies. That's the answer to everything. It's pretty much always
You know what I hear, and I've conducted a lot of these interviews with doctors over the years, and everything, the common thread is diet and exercise as far as prevention.
Yeah.
And, I recently had a mild heart attack, and what I learned after that, basically the way I surmise it today is, as far as diet goes, do all the things everybody's been telling you to do all your life. Yeah. Cut down on the fat, cut down on the red meat, cut down on processed food, more vegetables, more fish, more of the protein-packed product, and stay away from processed food, canned food and such, because you suddenly become aware to this. And when you start reading those labels, there's a reason for these labels.
Yeah.
But once you hit that awareness factor and you start paying attention, it's alarming. What you've been doing your whole life.
Exactly. My mom always says everything we should be doing, we learned in kindergarten already, right? So eat your carrots and celery sticks when they're given to you, and go play on the playground.
Yeah.
So it all comes down to more activity and less junk.
I remember going through school. I think recess and lunch were my 2 favorite things.
Yeah.
All right.
They're important classes in your day.
All right. Dr. Alexis with us today, part of the All Care Health team, and we're talking about colon cancer, rectal cancer. March is colorectal Cancer Awareness Month, a little bit of a tongue twister. We'll be back here in just a moment with more.
When planning your next path.
And welcome back to Here's to Your Health, an all-care health program. And happy to have Dr. Alexandridis in the studio today. Now, Doctor, you are part of the Grants Pass Surgical Associates, which has teamed up with All Care.
Yes.
And tell me just a little bit about the practice in general.
So we're a general and vascular surgery practice. I've been in town for coming up on 5 years. I do general surgery. Colonoscopy is just one facet of the general surgeon's repertoire. So I think I did 360 colonoscopies last year. That's what they told me. So I do a lot of scopes. But it's not the only thing I do. I get that question a lot, actually. Is this the only thing you do? And I'm like, nope, it's not the only thing I do. So I do a lot of breast surgery, treating breast cancers, breast lumps and bumps, helping women get through abnormal mammograms and through their breast cancer journey. I do a lot of hernias and gallbladders and appendectomies and whatever else comes in through the emergency department when we're taking call. If you ever need a general surgeon, you might meet me. I have 3 other partners, Drs. Dethridge and Dr. Schulte. They also do general surgery. Dr. Jones is our last partner, and he does vascular surgery and general surgery, so he treats arterial disease. Dr. Dethridge also loves treating vein disease, so varicose veins and any other diseases related to the veins in your legs. That's his little niche. We have a very busy practice, but we're always available to get people in. So.
All right. Well, for the guys out there, and I don't like to target guys or gals, but I know guys are like this, and they're thinking, I don't want to miss work. I don't want to do that. I have things to do.
Yeah.
Well, you need to understand the importance of a screening.
Yes.
And we've talked about this on the air. Carl Wilson, our owner, was diagnosed with colon cancer, and he spoke on the air about the importance of pre-screening. So this is not going to disrupt your life to get it checked out. What's going to disrupt your life is if you ignore it and all of a sudden have symptoms and things of that nature. So what do you tell the guys that are, a little hesitant?
I usually say it's one day out of your life, out of 10 years, most likely, where you get to really do something for yourself. And it's certainly a lot better than dealing with a colon cancer, because that's a lot more days out of your life.
Yeah, a little more complex.
Much more complex.
Yeah. So, wow. Okay. Well, I just want to kind of recap to people out there that it is the 3rd leading cause of death in the United States, number 3 on the list. And 50 is the average age for, basically a target age for your initial screening
exam. Yes.
And again, if you have family history, that is a red flag. You might want to consider lowering that to 40, 45 years of age.
Correct.
Sound good?
Yeah.
Guys and gals, we're all in this together. It's a even Steven risk. No sex has a higher risk than the other, according to statistics. All right. Well, if anybody, do you want to take a question? If anybody has a question in the listening audience, we have time for maybe one, maybe two, if you keep them brief. 472-1270, and you can talk to Dr. Alexis or Dr. Alexandridis. I'm going to get this right before we're all done. I may never see you again, but I'll know this. I'll know your name. 472-1270, if you have any questions about this. Want to remind everybody that although March is set aside as Colorectal Cancer Awareness Month, any day is a good day to think about it, talk about it, at least have a conversation with your physician. And then they may refer you to Dr. Alex here.
See me.
Or, who knows. But, again, I have gone through that, and it's a painless ordeal. And mine came out clean, so it made me feel great.
It should.
So it's a good feeling.
Yeah.
What about cost?
So commercial insurers, Medicare and Medicaid, the Oregon Health Plan, all cover screening colonoscopy because it's a preventative care exam. So it should be no cost to you. I do get questions sometimes about, well, if you take out a polyp, am I going to get an extra bill? My gut feeling on that is that you shouldn't be punished for having a polyp removed. That's not your fault that you had a polyp and I took it out. The Affordable Care Act and the Oregon House bill, I think it's number 4085 actually, have both agreed with me. Those pieces of legislation are preventing any additional charges to a patient if I take a polyp out. So you're not going to get an extra copay bill for polyp removal. Medicare is a little bit different. They still might charge a copay if we do a polypectomy. But I've actually talked to one of our United States representatives about maybe getting that changed, because I think that's an old holdover, and that should also be covered under the Affordable Care Act.
Are you looking at maybe getting a lab cost in addition?
Yeah, it would be like a lab cost, and it changes when you code the procedure. It changes the number of the code, so the charge is more. But I don't think that the patient should be on the hook for those charges. It's not the patient's fault. They're coming in for their screening exam, so it should be covered as a preventative test still.
All right. Well, check with your insurance, and if
the bottom line is always check with your insurance provider.
Yeah, and if you're looking for an insurance provider, you might consider All Care Health. All right. They're really becoming quite the force here in our area, and you're hearing the name all over the place. And another good thing about it is you see them getting active in community events all around. So they're brand new building coming up, and
great work, and
going to be a force in town.
Yeah, I mean, I had an all-care meeting yesterday, and they were talking about early childhood education projects. I was like, that's the group I want to be with. They were having an awesome time doing educational issues with early Head Start and Head Start kids. It sounded like a great program.
Just don't ruin the peanut M&M thing for me.
I'll take it away. No more peanut M&M.
I'm going to have to come up with another analogy for that one.
A food you don't like.
Right, Brussels sprout. But actually, I do like those. Anyway, well, Doctor, anything else that you'd like to get out to the general public while we have you here?
Yeah, just don't be afraid of taking a day for yourself and getting your colon looked at. It's a very important organ.
Yeah, oh, yeah.
You're going to miss it if it's gone, put it that way.
Indeed. Yeah. All right. Well, let's see. Again, I want to offer an opportunity to ask Dr. Alex any question you may have about colorectal cancer, 472-1270. This program is in its infant stages, if you will. We're just getting rolling here, but we plan to bring medical professionals to the airwaves the final Thursday of every month now, compliments of All Care Health. They're behind the scenes working with arranging different professionals from different areas of the medical field, and they're here for you. So again, we have a doctor on call, if you will, right now at 472-1270. And just a couple of minutes as the time ticks away, we have to join the Associated Press right at 10 o'clock for the latest. If this program is of interest to you, specifically the colorectal cancer, if that's of interest to you or maybe someone you know, this show will be archived on our website. So we encourage you to go to KAJO.com. Under the on-air tab, you will see this, and you'll be able to find it. If you have any trouble navigating that, just get a hold of us, and we'll take care of that. If you want to contact Grants Pass Surgical Associates, their phone number is 474-5533. Again, 474-5533. And where are you guys located?
We are at 1600 Northwest 6th Street. It's up on the north side of town, just by the Dairy Queen and the Les Schwab.
All right. Easy enough to find.
Yes.
So get your cancer screenings done. Again, if you're in generally good health, male or female, 50 is the target age. We've all heard that. Again, family history plays a big factor in your whether or not you're a good candidate for getting cancer, and we certainly hope you're not. But early detection is paramount in this field. And
your veggies,
sooner the better. Then we get back to diet and exercise, which I think you're going to find everything you've learned. Like the good analogy, I like that. Everything you learned in kindergarten is something that you should take to the grave, really. And I don't want to make it so terminal, but that's what it all comes down to. So eat your veggies, get your exercise in, and get your screenings done. And if you have any questions about health care or health insurance, you can always contact All Care Health. I'm gonna put those headphones on there. We have one call, and I think we'll have time to just barely squeeze this in. Good morning.
Good morning.
You're on the
This
air.
is Sherry Gunstein.
Hi.
Hello.
Quick question.
Pardon me?
What's your question?
Well, the question is I did have colon cancer 5 years ago, and I wanted to encourage anybody to not put it past 50 years old to go get their colonoscopy. I waited till I was 57. 57, I'm sorry. Mm-hmm. And they found it in a colonoscopy, time, and I woke up to find out that me being a vegetarian and eating right, it just, you don't even have to eat those fatty foods. But there is life after cancer, so I wanted to encourage anybody that, is kind of contemplating that in the back of their mind, or they just found out they have colon cancer, that there are definitely wonderful surgeons out there, and there is a bright future.
All right. Appreciate the call.
Okay. Thank you. Bye-bye.
All right. Well, yeah, I was pointed out that I made a error in Carl had the prostate cancer, not colon cancer. So little different there. So
little different.
My mistake. My point, though, was to get early detection, because he did, and again, by catching that early is really helps the prognosis.
Yeah.
And just as our caller just mentioned, again, early detection. So I don't know what could be holding anybody back. I think if you enjoy life, it's something worth, at least looking into. All right. So
talk to me about it. At
least.
Yeah.
It's pain-free. Like I said, you look at the preparation. I think most anybody that has gone through that will agree that's probably the most. And I'll just put the inconvenient label on it. Stay home, get prepped, get it taken care of, and you'll be back to, hopefully a normal life. Let's see. Well, we're down to about 30 seconds here. I told you our time would go fast. I want to thank you for coming in today.
Thanks for having me.
We want to thank All Care Health. Again, if you need to get a hold of Grants Pass Surgical Associates, their number is 474-5543. To find out more about All Care Health, log on to the website, allcarehealth.com. You've been listening to Here's to Your Health. Again, the show will be archived on our website at KAJO.com. Nice meeting you.
Nice meeting you. Thanks.
All right, we're going to join the Associated Press for the latest in headline news. And, hey, coincidentally, it's brought to you by All Care Health. Everything you need for health care and health care services all under one roof. It is just about 10 o'clock.
Evergreen